welcome to Tooth Be Told, where Kristin Linder, veterinarian and Diplomate of the American Veterinary Dental College, chats with veterinary dentistry experts who spill the secrets behind the smiles. From practical tips to fun behind-the-scenes stories, this podcast is made for veterinary professionals with a passion for dentistry. Tooth Be Told, we can't wait for you to join us. Hi there, and welcome to Tooth Be Told, your inside look at the Periovive training team. In each episode, we explore who we are, what we do, and the powerful role that hyaluronic acid plays in advancing patient care in veterinary dentistry. Today, we are thrilled to have Sally Outhwaite, a veterinary technician specialist in dentistry. Welcome, Sally. Great to have you here.
Thanks, Kristin.
All right, let's jump right into it. Tell us about yourself, tell us about your training, your current roles, etc.
Okay. Well, I have been a veterinary technician for about 25 years, and the last 20 of those years have been specifically in dentistry. I got my VTS almost 5 years ago, and so I've been focusing on education and teaching because I just really enjoy sharing about teeth. Almost to the point where I'm a little bit annoying about it because I get so excited about teeth.
I love it. And what initially drew you to dentistry? What is it that you love so much about it?
Initially, it was I needed a job. And the very first veterinary hospital that I applied at, during the interview process, they asked me if I would be willing to do dentistry. And I said, sure. They said, okay, because our gals here, they don't like it. They don't want to do it. And I need someone to do it. And I said, well, I don't have a ton of experience in dentistry. And he was an older guy, and he says, oh, we'll get you trained up. And so that is what I did there. And so it was kind of, circumstantial. And from that point on, I just dove right in. And the more I learned about it, the more I liked it and enjoyed doing dentistry, learning dentistry. And so it became pretty obvious once I found out that the VTS program in dentistry existed that I was going to do that no matter what.
Yeah, I love that. I had a similar upbringing in dentistry, I guess you could say. I just was surrounded by people who needed more dentistry or just had a special interest in dentistry. And I think it fostered that in myself. So I can relate there. And I didn't know, Sally, that you have been in dentistry specifically for about 20 years. That's incredible. So
yes. Cool. Once I worked at that hospital for 3 years. When I moved to the next hospital, they were ecstatic that I had that training in dentistry, and they said, oh, great, that's what you're going to do here. And I said, okay. And so that's pretty much all I did there. And that just continued wherever I went, because there is that need for someone that has that knowledge and the information. And if you're someone like me, I go digging for it. I look for studies. I look for information on it because I want to know more. And I found that made me valuable as an employee to a lot of different places where I worked.
Absolutely. I love that. Yeah, we're kind of nerds, aren't we?
Yes. When I'm talking to new technicians, I always tell them, find something that you love about veterinary medicine. Find something that makes you excited and fully put yourself into that. And that's going to make you invaluable to your team. So for me, it was dentistry. And when I'm talking to that next generation of technicians, I just want them to know there is something out there for you. Find that thing that you love, and it will make a very hard job much more enjoyable.
Yes, I agree with you. That's awesome. Tell me what specifically about dentistry that you love, or what's your favorite part of dentistry?
My favorite part is the recheck. When those clients come in and they say, oh my gosh, it's like I have a new dog, or my cat has been playing and is so much more affectionate, and I can't believe I didn't do this sooner. That, like, I get teared up about that.
Yeah.
That is literally my favorite part, to know that we made that much of a difference in that pet and that owner. That just means everything to me. I love to hear that. I love when they come back and they just say, oh, he's playing, he's doing this and that. And I just thought, it was old age. I didn't realize it was pain. And it's like, wow, we did something really, really great for that pet.
Yes. I think there's a common misconception that if our pets are still eating, that they're not in pain. And when you make that difference and you perform that procedure and perform those extractions or whatever the treatment required is, and they come back and they show a difference, it's, I think it becomes pretty clear that just because they're eating doesn't mean they're not in pain and that we can't make a difference. So I agree with everything you're saying. Absolutely. All right. So let's get into this article. I hear that you read an article and you're going to share some of that information with us. You picked a dense article. There's a ton of information in that review. So tell us a little bit tell us the title and the author if you have it, and then just summarize the main goal of the article for our listeners.
Okay, so the title is Hyaluronic Acid, a Novel Approach in Regenerative Reconstructive Periodontal Therapy. And it was published in Periodontology 2000 in 2025. It's a little bit of a confusing name of the journal, Periodontology 2000.
Yeah.
But the article was published in 2025. And it is basically a review of different studies of hyaluronic acid. So it looked at the works of another study. Poloni is the main author of this one. It looked at the intrabony defects study. From that, it looked at Shirikata study. It looked at the Cairo and I can never say this correctly, Cortellini. There we go. Cortellini study. But it referenced between 50 to 100 different studies on hyaluronic acid in dentistry. And the thing that I really liked about this article is that it goes into a deep description of what exactly hyaluronic acid is and why it works. And to me, that was information that I really, really wanted to have. I really was interested in knowing what was so great about this molecule.
Yeah, that's neat. That's incredible. You said there were about 50 to 100 different references in this review article alone.
Yes.
That science is really there, isn't it?
Yes. Some of the references were cited and then others were referred to. And so it's hard to determine exactly how many references there were, and I tried, but there was a lot, and it's just a very good comprehensive paper describing all of the things that hyaluronic acid can do in dentistry.
Amazing. So based on the evidence reviewed, what clinical improvements are associated with hyaluronic acid?
So periodontitis, periodontal disease, the studies looked at studies on that. I'm going to start over. That sounded weird. Studies on studies.
You're fine.
It looked at periodontal disease, and it looked at how it improved it. So it discussed chronic inflammation and how hyaluronic acid reduced pocket probing depth and improved clinical attachment levels. It decreased the inflammation, and it just enhanced the overall healing. It also looked at intrabony defects and periodontal pockets, okay? And what it showed there is how hyaluronic acid promoted bone regeneration. It increased connective tissue attachment, and it improved healing overall. It's a very regenerative molecule. It showed in gingival recession it enhanced soft tissue healing, and it improved the root coverage and tissue quality and thickness of the gingiva. I also looked at furcation defects, and it showed how hyaluronic acid stimulated new connective tissue, cementum formation, and bone regeneration. And then it looked at periodontal wound healing in general. It showed how hyaluronic acid stabilizes blood clots and increases growth factors and cell migration and proliferation in order to create healing in a faster environment. And then inflammation-related periodontal damage. So it looked at reducing inflammatory mediators, and it helped regulate the healing response. And it balanced inflammation and regeneration. So you didn't get that granulation tissue or epithelial downgrowth. There are a lot of different ways in which hyaluronic acid improves periodontal disease, dental disease in general. And this article just reviewed all of those. So I found that very helpful.
Nice. I love that you mentioned that it aids in preventing that epithelial downgrowth, because that's so important in our periodontal therapy. Our goal is to restore the periodontium and the native tissues that are there. And I've constantly been amazed at using hyaluronic acid as a therapy and the power that it has in regenerating the periodontium. So good point that you made there, Sally. Tell me a little bit more about the structure of hyaluronic acid. Is all hyaluronic acid the same?
No, so there are two different main forms of hyaluronic acid. In Periovive, we like to talk about high molecular weight hyaluronic acid and medical grade hyaluronic acid when we're describing the type of hyaluronic acid that is in Periovive. And basically, high molecular weight hyaluronic acid is a long chain of hyaluronic acid molecules, very long chain. And then there is low molecular weight hyaluronic acid, which are short chains. And the difference is that the long chain is more stable, it's thicker, and it's better at holding water. It's more anti-inflammatory, and it's there to produce a cushion for the cells. It's there to hold them in place. Low molecular weight is made up of smaller, tiny chains, and they are more active in the healing process. And so they bind easily to the receptors that are in the body, and they trigger a cell response that tells the body, hello, there's something here that's wrong, and we need you to fix it now. And so that triggering starts the healing process. It stimulates the cells to move into position and promotes the growth and promotes the formation of new blood vessels. And so when we're looking at Periovive, our product starts off as high molecular weight hyaluronic acid, and as it gets absorbed, it breaks down into low molecular weight hyaluronic acid. And then it starts making those cells do their job faster in order to promote healing.
So there's quite an array of different responsibilities.
Yes.
And it's neat that, I think something that is so interesting about hyaluronic acid is with those different molecular weights, it can do opposite things, just like you said. So I think about how we want ultra high molecular weight hyaluronic acid in, for example, joint injections in horses or in people. And that, I think it's interesting that ultra high molecular weight mimics that natural synovial fluid hyaluronic acid, which is naturally very high in molecular weight. Just like you said, it provides that cushioning, it decreases friction, and it has anti-inflammatory effects, which is what you want. You don't want to stimulate inflammation in a joint.
Correct.
But if you use low molecular weight, you're increasing inflammation, which is the opposite of what you want in, osteoarthritis. But in our periodontal defects, we need that active regeneration, not just protection. And so it's just so neat to me that you can apply it as high molecular weight, just like you said with Periovive. You get the benefits of the high molecular weight, and then it's absorbed, and you get the benefits of low molecular weight. So what a versatile molecule that we're talking about here. So thank you for describing all of that. With that said, to kind of put it all together, what's one key takeaway from this paper that you really want listeners to remember?
Well, what I really, really wanted was to explain exactly what hyaluronic acid was, because we hear it a lot. We hear about it in skin products. What I really wanted people to know when they read this article is exactly what hyaluronic acid is and why it works. So we hear about it a lot in skin products. We know that it's used in joint products. We know that it's in some eye products, right? So why does it work? Why does it do so many things in the body? So when I was reviewing this article, I wanted to put it in terms that are more easily digestible so that we would know exactly what this is and why it works and why there's so much science behind it. My goal was to make it make sense. If I can make it make sense to me, I can make it make sense to someone else.
I love that.
And so that was definitely my goal. The other thing is you're going to be talking to other VTSs who have reviewed articles, and they have reviewed some of the articles that are talked about in this paper. And so where they'll go into a deep dive of the individual articles, this kind of just reviews and puts it all together, all of the different studies that were done, and puts it together in a way that goes, okay, this product really, really works for multiple areas, and there's all of this science to back it up. So that's what I'd like people to take away when they read it.
Very nice. Yeah, it's a comprehensive article for sure. As I mentioned at the beginning, you picked a dense article, a lot of information, but I agree with you. I think it puts it into context as a nice review.
Yes.
All right, Sally, anything else you want to share with us today before we close here?
No, I think that reviewing these articles has given me a greater understanding of a product that I already love and that I already had a lot of information about. And so to be able to do this deep dive and get even more familiar with the hows and whys behind it, I feel like that makes me better at talking about this product, because it's just so exciting to me to see what it can do. And I'm so excited to share that with other people.
Yeah, I agree with you. There's so much behind hyaluronic acid and Periovive. And as I read these articles along with all of you, I learn something new all the time. It's incredibly versatile and effective, and that's what we want. So, all right, Sally. Well, thank you so much for joining us today and for sharing your expertise. It's been a pleasure learning from you. And thank you to our listeners for tuning in to Tooth Be Told. If you're passionate about veterinary dentistry, don't forget to check out more episodes and resources on periovive.com. Take care, and we'll see you next time.